Okay. Good afternoon, ladies and gentlemen. Welcome back. How are you feeling? Come on, I need a little bit more energy. You've had lunch now, so no excuses, huh? I hope you've had a good lunch and had a chance to recharge and spark new connections. If you're still making those connections, I'll kindly ask that you take your conversations outside so we can get the afternoon sessions going. Please, if you want to keep networking, having those chats, reuniting with your friends, please take them out of the room, the conversation, so we can get going. I appreciate it. Thank you so much. So for the first session of this afternoon, we're going to take a step into the world of African innovation with our second Unstoppable African Startup Spotlight of 2025. This morning, we had our first one. This is the second one today, the second Unstoppable African Startup. So please join me, ladies and gentlemen, in welcoming a trailblazer in Africa's startup ecosystem, a young visionary who's transforming the future of healthcare on the continent. He leads a fast-growing digital health company that delivers affordable, life-saving medical services through apps, SMS, and WhatsApp, and is already impacting lives across 9 countries on the African continent. With an unshakable commitment to accessibility, breaking barriers for underserved communities, empowering the next stage of Africa's health tech revolution. Please join me in welcoming to the stage Mr. Ikechukwu Anoke, founder and CEO of Zuri Health. Thank you, Ike. Thank you so much for being here. I'm so excited about this because what you're doing is incredible.
Thank you very much for having me.
Okay, let's start with the beginning. What basically inspired you to start Zuri Health? And you know, how did you envision technology helping you achieve what you set out to do?
Zuri is named after my daughter Zuri. It's a father's promise to a daughter. The circumstance of her birth and my personal journey during COVID was one of the reasons we built Zuri Health.
Okay, so personal.
Yes.
A personal decision.
Africa bears the highest disease burden in the world.
Right.
And when we look at the numbers, we have 1 doctor, 10,000 people, 2% insurance penetration rate, and half of the continent live on less than $1 a day.
Right.
So we are trying to democratize access to affordable healthcare on the continent.
Okay, so you're using technology to do that. SMS, WhatsApp, chat, how? And what made you think, okay, this is the route we need to go?
Well, we need to understand the fact that to build on this continent, you have to build inclusively. And when we look at the fact that perhaps 65% of mobile phone users don't have access to the internet or data, if you build on only apps and web, you will lock out a large portion of them. So we built the world's cheapest telemedicine consultation on text message, where people can be able to chat with a doctor and get first-level medical consultation via text.
Right. So you're present in 9 countries now. What has been the toughest challenge in trying to expand on the continent? And we're talking about different markets, right, and different needs. So what did you find was the most difficult?
Well, I think regulation. You know, in Africa, you either have over-regulation or under-regulation. The fact that there are no frameworks governing digital health, and that's part of the challenges we've had. Then we have the trust factor.
Yeah.
The fact that healthcare is a
it's something very
thing.
Personal, right?
Yes.
So how do you get people who are used to go see a doctor, especially, you know, in the rural communities, the rural areas, how do you get them to trust what you've set up?
I think it's a combination of, like you can see our state-of-the-art mobile clinic. We partnered with M-Pesa Foundation in Kenya to roll out healthcare across the length and breadth of Kenya, bringing the hospital to the people. Now, those people that we've seen, we onboard them onto a continuity of care platform using the SMS, the chatbots, and the rest of them. So they have already tested access to healthcare, and leveraging the trust equity of our partners, Safaricom and M-Pesa Foundation, it was easy to get them on board.
Okay. Now, you talked about partners. What role, more specifically, have partnerships played in basically helping you reach your growth? And what kind of ecosystem do you think is needed to get, you know, initiatives like yours to grow further?
I think good partnerships like what we have with Timbuktu, M-Pesa Foundation, and the rest gives credibility to the startup. It opens the doors. And also collaborations with policymakers, the government, helps build credibility for the process. Okay. And even from scaling and growth, partnering with big companies help you scale and grow.
Okay. Now, I think you have an announcement or something
Yes.
special you want to tell our audience.
And because it's health,
Yeah.
right, I'd like us to do something. Your Excellencies, all protocols observed, would like us to please stand up, please. Let's make a pledge for health. Can we all rise, please?
All rise for health. There you go.
So I'll say something and we'll reply, together we can, right? So for good health, together we can. For unstoppable Africa, together we can. And for Nina Senanu, my sister-in-law who I lost on the way here, together we can. Asante Sana, thank you very much.
Thank you so much. A round of applause to Ike. Well done. Thank you. That was amazing. From 9 countries today to an entire continent tomorrow. This is how Africa is revolutionizing healthcare, as you heard. Affordable, accessible, and unstoppable. Please, another round of applause for Ike.